Hey there! Today we're going to walk through how to check blood pressure accurately. It's a simple skill that can make a real difference in monitoring your health or helping someone you care about. Don't worry if you've never done this before. We'll take it step by step, and by the end, you'll feel confident doing it on your own. Let's start with getting everything ready. First, you'll need a blood pressure monitor. You can use either a manual one with a stethoscope or an automatic digital monitor. Make sure you have the right size cuff for the person's arm. Too small or too large can give you inaccurate readings. Find a quiet, comfortable spot where the person can sit and relax for about 5 minutes before you begin. This helps ensure the reading is accurate. Now let's talk about placing the cuff correctly. Have the person sit down with their back supported and feet flat on the floor. Their arm should rest on a table at heart level. Roll up their sleeve so the upper arm is bare. Wrap the cuff snugly around the upper arm, about 1 inch above the elbow. The bottom edge of the cuff should sit just above the bend of the elbow. Make sure it's snug but not too tight. You should be able to slip 2 fingers underneath. Time for the actual measurement. If you're using a manual monitor, place the stethoscope earpieces in your ears and position the disc over the brachial artery at the inside of the elbow. Close the valve on the bulb and pump it up until the gauge reads about 30 points above the expected systolic pressure. Then slowly release the valve. Listen carefully for the first heartbeat sound. That number is the systolic pressure. Keep listening until the sound disappears. That's your diastolic pressure. If you're using an automatic monitor, simply press the start button after the cuff is in place. The machine will inflate the cuff automatically and display both numbers on the screen. Either way, make sure the person stays still and quiet during the measurement. Any movement or talking can affect the accuracy of the reading. Once you have your reading, it's important to record it properly. Write down both numbers with the systolic over the diastolic, like 120/80. Note the date and time of the measurement. If you're tracking blood pressure over time, also write down which arm you used and whether the person had recently eaten, exercised, or taken medication. These factors can all influence the reading. Great job. You now know how to check blood pressure from start to finish. Remember, if you get an unusually high or low reading, take it again after a few minutes. If the readings are consistently concerning, contact a healthcare provider. Regular monitoring can help catch potential problems early and keep you or your loved ones healthy. Thanks for learning with us today.